Hi, I'm Dr. Scott Beavers. I'm a licensed chiropractor. I'm also a diplomate of the American Chiropractic Board of Sports Physicians. I want to speak with you today about the 5 subtypes of concussion. Concussions happen when there's a jolt or jar to the body or to the head that results in an injury to the brain. Sometimes they're called mild traumatic brain injuries, but make no mistake, there's nothing mild about a concussion if you've had one. Today we're going to talk about the 5 subtypes. The first subtype is called the autonomic. The autonomic subtype means that there's the autonomic nervous system. These are the nerves that control the inside of our body automatically. And when we've been injured and had a concussion, our autonomic system can get out of rhythm. Many times patients will have trouble with exercise, returning to exercise. Every time they start to exercise, they start to have more of their concussion symptoms. Also, they can be sensitive to light. They're photophobic. The eye muscles, the automatic muscles that open and close the eyes, are not functioning like they should. The second subtype is called the metabolic/hormonal subtype. People with injuries of concussion that are having metabolic problems or hormonal problems can have trouble with low energy, fatigue. They can also have trouble going to sleep, trouble staying asleep. They can also wake up in the morning and be very groggy and feel unrested. The third type, the vestibular or visual subtype of concussion. This can cause dizziness, problems with our balance. It can also cause trouble when we try to read or try to learn. The fourth subtype, the cervical. The cervical subtype means that there's been an injury to the head, but almost 100% of the time when we've suffered a concussion, we've also suffered an injury to the neck. Sometimes in the old days we would call that a whiplash type of injury. These types of injuries can cause headaches. They can cause headaches behind the eyes, on the top of the head, at the base of the skull. They can also cause neck pain, loss of motion in the cervical spine. The fifth type of subset is a combination of these subtypes of concussions in the head. Now, if it's been more than 30 days since your concussion and you're still having symptoms like I've described, it's possible you have post-concussion syndrome. We know that the most important factor for injured patients is the length of time between their injury and the time that they seek and find high-quality healthcare providers who are knowledgeable and skilled in treating concussion. If you've suffered a concussion and you're still having symptoms, please reach out to us.